It is an excellent opportunity. I really enjoy working in simulation, and I think that it is a very important part of nursing education.
Morning, Miss Miller.
How are you doing today?
Simulation allows students to connect what they're learning in the classroom with what they're going to do in clinical in a very realistic manner.
Absolutely. Or cephapeme.
So I think that that creates a very good learning environment for the students.
Here's your metformin and your levothyroxine. And you need some water for you.
It also allows us to put them in a situation that is very specific. So when we go to the hospital for clinicals, we are not able to choose what type of clinical experience that they have in each day. Whereas, for example, in a simulation, I can set up a sim that is specific to a patient having a heart attack, where that wouldn't be guaranteed that every student is going to take care of a patient who's actively having a heart attack when they go to clinicals.
I think that it definitely gets us out of our comfort zone and being able to think critically about things that we might have not thought of in the past, especially with someone we go to the hospital and we learn things with our nurses and clinicals, but we always are the second ear to things. And so being the first ear and first thought of what we need to come up with, and just with questions or diagnostics or labs that need to be ordered or following doctor's orders and stuff like that, being able to make those decisions by ourselves coherently. Also, the room of making mistakes and learning from them, I think, is really good.
This is Ruby Miller. She's an 81-year-old female. She presented to the ED with fever, coughing, fatigue, and poor appetite.
We have a brief before and we have a debrief afterwards. The brief is to prepare the student for the segment. They don't know exactly what's going to happen, but we will talk through what the patient presented to the hospital with, for example. So they have a little bit of information going into the segment. They'll go in, perform cares during the segment, they'll do their assessment and prioritize a plan of care and follow through on that plan of care. Afterwards, we debrief and we talk through each part of that segment.
So what do you think would happen if you pushed the Benadryl too fast? That's the question we need to ask, right?
It would be
So what are adverse reactions?
What went well, both from their perspective and from my perspective, and from their peers' perspective, because the students rotate through each segment, but the students who are not actively in the current segment will observe from the debrief room. They can identify what they would have liked to have done, but maybe they didn't have enough time, or what, if they could do it again, what they would have changed in that segment. And that provides a very good learning opportunity for the students.
I think that the more experience as a nursing student that you get to do things with patients is really helpful. As much as you get to learn things in the clinical setting, at the hospital, there's not as much hand-on experience. In this environment, you get to only have that hands-on experience and that feedback from it. And so it's really good to be able to be in an environment where it's laid back in a sense that you can make mistakes and learn from them and know what to do right in the long run.